I'd like to welcome to talk to us tonight Dr. Agarwalla. She is a board certified cardiologist specializing in cardiovascular medicine. She's committed to delivering compassionate, patient centered care, emphasizing clear communication, education, and shared decision making. Dr. Agarwalla partners closely with her patients to focus on prevention, early detection, and individualized treatment of heart disease. Thank you and welcome.
Thank you. Thank you so much for having me today. Our topic is how to better cardiac health at work. All right, yep, go ahead. I have no disclosures for today. So why does this matter? As of last year, according to the American Heart Association, heart disease was still the #1 cause of death here in the United States. In fact, the total number of deaths due to cardiovascular disease, such as heart attacks and strokes, still beat out numbers 2 and 3 causes of death, which was cancer and accidental deaths. And what's interesting about this is that many of the risk factors for cardiovascular disease do show up during a typical workday, such as prolonged sitting, increased stress, poor nutrition, and a lack of sleep. Today is not about making extreme changes or perfecting your lifestyles. It's about realistic habits that we can build into a busy corporate schedule. So how does work affect your heart health? Well, think about a typical day. You have back-to-back meetings, you have tight deadlines, constant emails, notifications, little time to rest. Most adults end up spending about 8 to 10 hours a day of sitting. Sometimes that's more sleep than some folks may be getting. What surprises or may surprise many people is that research has shown prolonged sitting increases cardiovascular risk, even if you happen to exercise regularly outside of work. This means you can go to the gym before work, after work, but your overall health can still be affected by how much you sit during the day. Thinking about what sitting is actually doing, it increases your cardiovascular risk by increasing inflammation, causing dyslipidemia, so how your body metabolizes cholesterol, impairing glucose control, decreasing your heart rate variability, and causing endothelial dysfunction, which is your arteries and how they respond to all of these different risk factors. So you add that combined with either skipping meals or having ultra-processed snacks that are high in sodium, low in fiber, low in protein. And it's not hard to imagine how all of these different habits in the work environment quickly adds up over time. The key point here is not that your job causes heart disease, but what can you do but how can we work better to mitigate the risks? All right, so what can we do? Yep. So stress is the first big factor to think about. It's not just in your head, it raises your blood pressure, it can even impact your heart rhythms. Both acute stress from things like anger or fear or traumatic event, along with chronic stress from work strain or financial hardship, can contribute to cardiovascular disease. Finding small ways to find relief from this stress could be a quick 60-second breathing reset in between meetings or phone calls. Setting some boundaries around constant notifications, especially after work hours, may be able to help. Yep. The next area to focus on is movement. The good news is you don't need intense workouts throughout the day. You just need to interrupt sitting. You can, these can be as simple as standing during phone calls or meetings, taking a 5-minute break every hour, setting an alarm on your phone, you choosing stairs over elevators. Very simple concepts. The idea is that you do exercise snacks. You break up part of the day where you're sitting and move in some way. Even if it's at the desk, if you do calf raises, that helps with overall metabolic health. And of course, diet will always be a key part of how you can better improve your lifestyle. So adding protein or fiber to your lunches, keeping snap peas on hand or a really good healthy protein bar, some fruits, some nuts, having some water before your cup of coffee will help with increasing overall hydration. And if you are going out to eat lunch or you're ordering in food because of, that's a social culture of your workday, choose better options, maybe eat half and save the rest for later. So all of these small steps overall can help with your cardiovascular health. So key takeaways is the hope that you move at least once every hour. Consistency matters far more than intensity. You don't need to have a perfect diet, just better defaults. And to remember that stress isn't just mental, it's physiological. It can increase your blood pressure, it can increase your inflammation, and it can trigger even unhealthy coping mechanism. Short stress resets throughout the day really matter, even if it's 60 seconds. And finally, thinking of sleep as a productivity tool. Work culture will often push aside your sleep. You know, there's a work culture where you may not have a boundary of I'm off at 6 p.m., no more work emails, no more work phone calls. But thinking about setting those boundaries is important. Protecting sleep isn't just good for your heart, it also improves focus, decision making, productivity. So you can truly think of it as a work tool. So the purpose of today was not for anyone to feel like they need to completely change everything they're doing at work. I urge you to think about a work week heart challenge where for the next week, just choose one of these many lifestyle options. It's changes that you can do. Maybe pick a 5-minute walk after lunch or just stand once every hour. You know, choose a consistent bedtime and hopefully these small but specific changes are ways to easily incorporate some of these heart healthy lifestyles to your day-to-day schedule. And finally, since we're talking about businesses, I did want to put a small plug for a screening program that the Heart and Vascular Institute at Hartford is starting. This will include an initial evaluation by a medical provider to, first of all, determine whether the screening program is for you. So the idea is that you're asymptomatic. Of course, if you're having symptoms that we are concerned about, we're not worrying about overall screening. We're doing more aggressive things. So no prior history of heart conditions that we know about. This is for just pure screening, sort of like a mammogram or a colonoscopy. And after the initial visit, once we've said, okay, you're appropriate for this program, we will order a battery of tests, including the advanced lipid panel, to look for different types of cholesterol molecules, such as apolipoprotein B, lipoprotein A, which maybe some of you have heard about, looking at your insulin resistance levels, looking at your omega acids, and then doing non-invasive, non-contrast vascular studies, such as a coronary calcium score, which is a CT scan of the heart, a carotid ultrasound, looking at the arteries in your neck. Having plaque in either of these vascular beds can increase the risk of a heart attack or a stroke. Once we have all of this information, which will be out of pocket, will take about 4 to 6 weeks, you'll meet with one of our cardiologists to go over all of these results, go over what did we find. You know, did you have vascular plaques in your carotid arteries that we didn't know about? You are not symptomatic with because you haven't had a stroke yet, but that doesn't mean you're not at risk because the disease process has started. We'll talk about what more can we do, how can we help with lifestyle, with medications, to overall improve your cardiac health. All right, that's it. Thank you so much.